Hi, I'm Jeannette Kaplun from Hispana Global, coming to you live from the Baptist Health Newsroom. Valentine's Day is almost here, and while everybody might be discussing roses, chocolate, date night, we want to talk about our hearts. Why? Because heart disease is the #1 killer of women in the United States. And that's why we invited Dr. Sandra Chaparro, because she is an amazing cardiologist, and she's also the director of the Advanced Heart Failure Program at Miami Cardiac Vascular Institute, because you are going to actually guide us and empower us with information. Welcome, Dr. Chaparro.
Thank you so much for the invitation. This is my first event in Facebook Live, so it's a pleasure to be here.
It's a pleasure for us too. And also, Facebook Live is amazing because we will be reading and answering your questions. So make sure to leave in the comments below all your questions, your comments, any concerns. Y también si tienen dudas en español, las pueden dejar. Dr. Chaparro is bilingual, so we will be reading and addressing all your comments at the end. Dr. Chaparro, one of the things that surprised me the most is that heart disease kills more women than all kinds of cancer combined. Could you elaborate a little bit more on this alarming statistic?
Yes, so cardiovascular disease is the #1 killer of all Americans. Talking about women, it's 1 in 3 women that will die because of heart disease. So it's an alarming rate, and we have to increase the awareness of heart disease. And we have to follow the steps of the breast cancer campaign, that they do a really good job in highlighting the mortality and the risk of breast cancer. But the likelihood of someone dying from breast cancer is very low compared to cardiovascular disease.
Wow, that is incredible, an incredible statistic. And the American Heart Association actually shares that approximately 1 woman each minute will be affected by heart disease?
Yes, so the mortality can be pretty high. The good news is that we can do a lot of things to change risk factors, to change behaviors, and so you can decrease the risk. So there are a lot of options. So the fact that you can make changes to your lifestyle means that you have opportunities to have a healthy, normal life.
And the other thing that you mentioned is risk factors, knowing if we are in a risk factor group. From my understanding, African American women are at a higher risk, and Hispanic women actually are diagnosed or start suffering from heart disease 10 years earlier than non-Hispanics. Is that correct?
Yes, so in terms of the African Americans, one of the major causes of cardiovascular disease is hypertension. So hypertension is underdiagnosed.
And hypertension is elevated blood pressure.
Correct. So it's really easy to go to your local pharmacy or to your local supermarket and get checked if you don't go to your primary care provider regularly. And it's easy to control with changes to your diet, decreasing the amount of salt, exercising, and medicines. And so that's one of the reasons why African Americans have higher risk of cardiovascular disease. In terms of the Hispanics, we have some other behaviors. We have a lot of pre-diabetes, a lot of obesity, and that's also related to our diet. We have a high intake in carbohydrates, all those sweets that grandma sometimes makes are delicious, but they're not necessarily the best thing. So we need to change that. We don't exercise as much as we're supposed to. The recommendation is to exercise 30 minutes a day. A lot of people don't have time, they have kids, and they don't prioritize their health.
And we're sitting at our desks, or we're driving, we're stuck in Miami traffic. So it sometimes makes it hard. Now, do those 30 minutes of daily exercise, do they have to be done in one block, or maybe somebody can break them out into 5-10 minutes increments to increase their activity?
Yes, that's a great idea, to do 10 minutes, 3 blocks of 10 minutes is that easy. But you have to be consistent. You have to have a routine. And sometimes you say, oh, I don't have time, right? I have to take the kids to school. I have to take the kids to practice. So it's, for example, combining some of these things, taking the stairs. While your kids are playing soccer, go around and walk. There are ways if you have the will.
It's true. And also, there are many exercise programs on the internet as well. So it's not even a matter of money, of taking the stairs, as you were mentioning, parking away from the entrance to the building that you're going, to the supermarket. That way, you incorporate small changes that can have a big impact. Now, also, women are notorious for being the healthcare decision makers, for being caregivers. But why do you think sometimes we are so behind taking care of ourselves and our health?
Yes, that's a problem. We tend to prioritize the kids and our relatives, but we need to focus on ourselves, because in the long term, if we are not there in 10 years for our kids, who's going to take care of the rest of the family? So yes, you need to prioritize, you need to do it, and you need to do it now. It's not that difficult. There are basic steps that you can make. For example, know your numbers. That's one of the major highlights of the American Heart Association campaign.
So which numbers do we need to know?
So your blood pressure. So as we mentioned, that's a marker of hypertension. So easy to go to any local pharmacy or any local supermarket, or ideally your primary care provider, and get checked. Know your numbers. The second one is your cholesterol. So it's a blood test, and obviously that requires a visit to the doctor so that they can explain what they mean, the bad cholesterol and the good cholesterol. There are some other risk factors that are really important to mention. The smoking. Smoking is one of the biggest problems that we have. So smoking will decrease not only the risk of cancer, but also cardiovascular events.
So if somebody stops smoking right now, they immediately can start helping their heart.
Definitely.
And that includes vaping as well, correct?
Correct.
And what other risk factors, knowing our family history maybe?
So those are risk factors that we cannot change, right? Our age, our sex, or the genetics. So we need to take control of the ones that we can change. And
which
the
is diet,
exercise, going to the doctor, knowing your numbers, and following those recommendations.
Many women think that just by going to the gynecologist once a year, that with that, I already had my yearly checkup. Is that enough? Or should we be doing much more? Maybe visiting a primary care physician, asking for more blood work. Any tips, doctor?
Definitely, you need more than that. And so ideally, once a year, you have to have blood check. So cholesterol levels, something easy that if you don't want to combine it with another visit, you can ask your OBGYN provider, and they can easily do that at the office visit. And at the same time, they can check your blood pressure as well.
And what about glucose? You were mentioning higher levels of prediabetes or diabetes type 2. So what should we be doing as women to actually take charge, because sometimes there are no symptoms?
So during the same blood test that you check cholesterol, you can do the glucose, and among other markers of prediabetes. But again, it's changing your lifestyle and exercise, but know your numbers. That's the bottom line.
Now, there's something else that many doctors discuss and that women are not aware of, that the symptoms of heart attacks, heart disease in women are different than men. Could you explain a little bit more about that?
So we're definitely much different. In women, the chest pain that is classical in men is not that common. So usually the presentation is fatigue. And so imagine how many things can produce fatigue. And it's very
women
specific.
are always tired.
Right. So when you see a change on your physical activity, when you see that you don't have the same energy, when you see that you're more short of breath than normal, those are signs, those are red flags that something is going on. So that's when you need to get checked. Again, sometimes we don't do a good job doing the awareness, not only with the community, but the physicians. So sometimes the patients can get misdiagnosed.
Okay.
So you need to persist. If you have a symptom, you don't feel well, it's not because of your age. It's that maybe something is wrong and they need to look into more detail. And there are a lot of tests that can be done to identify the reason.
Okay, that's important then, because sometimes we ignore our symptoms or we minimize our symptoms, and sometimes doctors might misdiagnose. So if we know our numbers, that might help make a more accurate diagnosis, correct?
Yes, that's really important. And again, you have the symptoms, go to the doctor, don't delay, because if you wait until you go to the ER, it might be something very serious that might be not reversible. So it's important to go on time.
Okay, that's a really great tip. Now, let's say that I went to the doctor, I had my checkup, and I realized that I have high cholesterol. But then I start looking at my numbers and maybe I hadn't had blood work in a while and I've always had it. Can high cholesterol be genetic?
There are multiple reasons why you can have high cholesterol, and genetics is one of them, but it's the minority of the cases. The majority of the cases is related to our Western diet that is easy to change if you just make the right selection.
And increasing fiber intake, physical activity.
Correct. There's a lot of tips, and again, it's important to personalize your diet to your needs and to your lifestyle.
And that way you'll feel much better too,
yes.
Correct? And how long of a period of time can people start seeing this change when they start taking charge of their health and making healthier choices for themselves?
So usually within a few months, usually 3 months, you can see changes on your numbers, on your blood pressure, on your glucose, which is the sugar, with your cholesterol. So it can be quick, but they have to be follow-up.
And consistent.
Correct.
So that's a really important tip. Let me check, because we are actually getting a question here about, is there any emotional and spiritual connection to heart health?
Of course, we are connected, brain and heart, and actually they are important diseases that can be caused because of a stress. So we have a type of heart failure called cardiomyopathy, and the specific name is Takasubu. And that one is when you have a stressful situation, the death of a family or something really important, and your body releases all these hormones and all these chemicals that can affect the heart. So usually the treatment for that is we give medicines to sustain the heart during the period of time, and then the heart recovers if you can remove the stress force or out of the equation.
So if we learn to manage the stress, then it will also help our heart health.
Correct. Again, stress contributes to high blood pressure. High blood pressure contributes to cardiovascular disease.
It's all interrelated. And what are the most common heart diseases that we are seeing? Arrhythmia?
So heart attacks, what we call coronary artery disease, is when we have blockages in the arteries of the heart, the blood going into the heart muscle. And that's caused by cholesterol plaques, by stress, rupture of thrombus. So blockage of the nutrients going to the heart muscle, that's the most common cause of heart disease.
And then what other kinds of problems are you seeing among women?
Arrhythmias is another problem. So sometimes when the rate is too high, so sometimes,
or the irregular heartbeat,
when you skip, and so all those things need to be monitored, and there are medicines that can manipulate the rhythm, and obviously you need to find out what's the cause of the problem. Sometimes if you have a chemical imbalance, for example, the thyroid is not doing well, that's something easy to check when you go to see your primary care physician. You adjust the thyroid, and then the arrhythmia can resolve.
Which a lot of people need to understand. All of this is detected in your yearly checkup, which we all need to do. If we want to take better care of everybody that we love, we have to start by taking care of ourselves. Dr. Chaparro, is there anything else that you would like to tell women that are watching this Facebook Live, or maybe the men who love women in their lives, who want to start taking notice of everything that can be done to improve our health? What would you tell them aside from getting this yearly checkup?
So awareness, and just talk about it at home. It's not just about mom, it's also grandma, everyone around the house. Awareness is the most important part, because if we are aware of how serious this problem is, then we can make changes, and then we can live better and longer.
Which is what we all want to do. And I think this is very empowering information. So start making changes to what you are eating, to what you are doing, how much you are moving. Let's all start moving more. I have to say, I am guilty as anybody else of not being as active as I should be. And we have to stop making excuses because our health is much more important, not only during Heart Awareness Month, during Valentine's Day. This is something that we need to do because also we are teaching our children all the habits for their own lifestyle, and they're watching us. So any other questions that you tend to get commonly in your practice?
So I deal with very sick people, and usually it's at the end of the spectrum of the heart disease. So that's when the tough questions come in. But again, if we want to make changes, really easy to say but not to do is to stop smoking. That's one of the major issues. And exercise, diet, exercise. So those are really easy things to do because we can decrease the chances of developing heart disease by 80%. Just
80%?
Controlling
Wow.
the risk factors. Again, we cannot control age, we cannot control our sex, or we cannot control your genetics. But even though if you have those risks, if you make lifestyle modifications, you are going to have a better quality of life.
Yeah, and it's a huge change in prevention. That is incredible. We also got another question. A lot of people are starting to run marathons or have made really good choices in leading healthier lifestyles. This question says, I'm an avid runner, but when I run long distances, my heart rate goes up to 190. Is that normal? What would you tell Katie?
Well, in her case, it's important to know her age because everything is related to age and also to the amount of effort that she's putting into it. And so in general, you should not go over 85% of your maximum predicted heart rate. And so I cannot comment specifically because I don't know her age. But if you don't feel good, if you feel that there's something wrong, sometimes you can have palpitations that shouldn't be there. I would suggest to get checked.
Okay, and for people who are doing all these cycling and very intense spinning classes, their heart rate also tends to go up quite quickly. Is there any risk?
So you have to monitor yourself, right? And you have to go based on what your body is telling you. I would not suggest to start doing an intense exercise program if you have not done it before. And so if any questions, if you don't feel right, always get checked.
And what we need to remember is that the heart is a muscle. So
Correct.
The more you start exercising, the more the capacity increases and the better you will feel because it will become more efficient, correct?
Yes, that's correct.
Well, thank you so much, Dr. Chaparro. I think this is such valuable information. You can follow us on social media. All our handles are going to be on the screen. Baptist Health South Florida has so much information and has amazing specialists also to help you, to guide you, because as Dr. Chaparro was mentioning, it's very important to discuss with your doctor any changes that you're going to make into your lifestyle, because even if you're going to make healthy changes, sometimes we need a little extra guidance and just to make sure that there's nothing else going on. Don't ignore your symptoms. Stop smoking. If you're smoking, do it right now. Dr. Chaparro was very clear on the benefits of doing it, even if you've been smoking for years. Stopping really helps increase your health and you will start feeling much better. Decrease sodium, know your blood pressure, know your cholesterol, your family history, and focus on what you can change to improve your health. Thank you so much, Dr. Chaparro.
Thank you. It was a pleasure.
And right now, that's all the time we have for this Facebook Live. Remember to keep adding your questions and comments. Even if you're watching a replay, we will still get to your comments and questions. Remember to follow Baptist Health South Florida on Facebook, Instagram, LinkedIn, everywhere for more tips and information and on their blog. I'm Jeannette Kaplun. Till next time, and thanks so much for tuning in.